Hello, this is Dr. Munjal. Today I'll be talking about anxiety disorders. Particularly, anxiety is a natural response to stress characterized by feelings of worry, nervousness, or fear. It's a normal part of life, but when it becomes excessive or interferes with daily activities, it may be classified as one of the different anxiety disorders. There are different kinds of anxiety disorders. First one includes panic disorder. Panic disorder involves recurrent, unexpected panic attacks, sudden periods of intense fear that peak within minutes, and the symptoms of the panic disorder include heart palpitations, sweating, trembling, shortness of breath, feelings of impending doom. Agoraphobia is another kind of anxiety disorder where there is a fear of being in situations where escape might be difficult or help might be unavailable during a panic attack. This may lead to avoiding places like open spaces, public transportation, or even leaving home. One of the most common kinds of anxiety disorder is generalized anxiety disorder, also called GAD. It is characterized by chronic excessive worry about various aspects of daily life. People with generalized anxiety disorder often experience restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbances. Another common type of anxiety disorder is social anxiety disorder. It involves an intense fear of social situations where one might be judged, embarrassed, or scrutinized by others. This often leads to avoidance of social interactions and causes significant distress in social settings. Now, anxiety is a common human experience. It's only when it becomes intense enough, prolonged enough, that is causing oneself functional impediment in work, relationships, or both, that it starts to become a disorder enough that it needs treatment. There are different kinds of treatments that are often tailored to the individual's specific need. The most common one is psychotherapy, which includes exposure therapy, which is often used in phobias or PTSD, which involves gradual exposure to feared object or situation to reduce anxiety over time. Cognitive behavioral therapy is also one of the most effective forms of therapy for anxiety disorders. It helps individuals identify and challenge these negative thought patterns and behaviors. Medication is extremely important as well, and in some cases, it is needed in addition to therapy. The most common ones are antidepressants, which include SSRIs or SNRIs, which stands for selective serotonin reuptake inhibitor, and selective norepinephrine reuptake inhibitor, respectively. If the antidepressants cannot treat this anxiety or it needs further help, then we can prescribe benzodiazepines, beta blockers like propranolol, gabapentin, hydroxyzine, and other medications. The medications like these that are taken in addition to antidepressants can have some addictive potential, but not all of these medications have addictive potential, and not all of these medications have tolerance build up, but some of them can. So it's very important to be cautious regarding the same. One of the most underlooked issue is lifestyle changes, and these include regular exercise, which is shown to reduce anxiety symptoms, a very healthy diet, where a balanced diet can actually improve overall mental health over long periods of time and is crucial for anxiety disorder. Sleep hygiene is also really important because ensuring that one has an adequate and quality sleep helps manage anxiety as well. Other techniques that can help the individual includes mindfulness, which is essentially staying in the present, paying attention to the stimuli that you're present in, which can help reduce stress, deep breathing exercises, which helps calm the nervous system, and one of the most prominent one that a lot of people practice is progressive muscle relaxation, which involves tensing and then relaxing different muscle groups to reduce physical tension. One can also join support groups and also employ other self-help strategies such as journaling or time management to reduce the feelings of being overwhelmed and help process emotions. Thank you very much.